Hello, this is Dr. Cruz. I want to talk to you today about something we've been doing a lot of here in the office lately called functional medicine. You may have used the term used loosely here, and what I want to explain is some of the basic differences between what you would see done in functional medicine as opposed to what you might be used to with traditional medicine. And the basic tenet here is to do some very thorough lab work and then look at this lab work not just to see what's normal and abnormal, but to see what's functioning at its absolute best, the way the body is designed to work at its best. So to give you an example, we'll use these lab values right here. Standard medical tests, you have an abnormally high lab value somewhere up in here, or an abnormally low lab value, somewhere down there above or below that red line. So this is what we would call pathological, something going on in these ranges. So definitely there is something wrong going on right here. To give you an example, let's use diabetes. Diabetes, when your blood sugar, let's say you pass out and they check your blood sugar and it's spiking at 300 or 400, that's pathological. Whereas your diabetes might have been high for months, even years, but not to a pathological level. Therefore, you never caught it, nobody else ever caught it. So that's what we're looking at with your standard lab values, the way your doctor might look at it. As a matter of fact, your doctor might get a report and they're not going to look at anything except for what the lab has flagged as abnormal, abnormal, abnormal. And they say, oh, we have some pathological problems. And I'll take that one step further. If you have insurance, your doctor cannot even treat you unless there's a pathological abnormal value as far as your insurance is concerned, because they have to be able to give it a code in order to give you a treatment for your insurance to pay. What we look for in functional medicine is not necessarily waiting for something to be pathologically abnormal, but we'll have a tighter range within these green lines here. So this is the range where your body is going to function its very best. And these values have been carefully researched and documented. So anything above or below this range may not necessarily be pathological, but we know the body is not functioning at its very best. This is the time to be addressing this. Let's not wait for it to get pathological. We wouldn't want to wait till you have a diabetic coma to treat your diabetes. We wouldn't want to wait for you to have a heart attack to treat your heart problem that's developing over many, many years. This is what functional medicine is all about, to get to your body functioning before it gets outside of these healthy, normal values. Thank you.